وآل محمد. اللهم صل على محمد وآل محمد. اللهم صل على محمد وآل محمد. اللهم إني أسألك الأمان يوم لا ينفع مال ولا بنون إلا من أتى الله بقلب سليم، وأسألك الأمان يوم يعض الظالم على يديه يقول يا ليتني اتخذت مع الرسول سبيلا، وأسألك الأمان يوم يعرف المجرمون بسيماهم فيؤخذ بالنواسي والأقدام، وأسألك الأمان يوم لا يجزي والد عن ولده ولا مولود هو جاز عن والده شيئا، إن وعد الله حق. وأسألك الأمان يوم لا ينفع الظالمين معذرتهم ولهم اللعنة ولهم سوء الدار. وأسألك الأمان يوم لا تملك نفس لنفس شيئا والأمر يومئذ لله. وأسألك الأمان يوم يفر المرء من أخيه وأمه وأبيه وصاحبته وبنيه لكل امرئ منهم يومئذ شأن يغنيه. وأسألك الأمان صل على محمد وآل محمد. وأسألك الأمان يوم يبد المجرم لو يفتدي من عذاب يومئذ ببنيه وصاحبته وأخيه وفصيلته التي تؤويه ومن في الأرض جميعا ثم ينجيه. كلا إنها لظى نزاعة للشوى مولاي يا مولاي أنت المولى وأنا العبد وهل يرحم العبد إلا المولى. مولاي يا مولاي أنت المالك وأنا المملوك وهل يرحم المملوك إلا المالك. مولاي يا مولاي أنت العزيز وأنا الذليل وهل يرحم الذليل إلا العزيز. مولاي يا مولاي أنت الخالق وأنا المخلوق وهل يرحم المخلوق إلا الخالق. مولاي يا مولاي أنت العظيم وأنا الحقير وهل يرحم الحقير إلا العظيم. مولاي يا مولاي أنت القوي وأنا الضعيف وهل يرحم الضعيف إلا القوي. مولاي يا مولاي أنت الغني وأنا الفقير وهل يرحم الفقير إلا الغني. مولاي يا مولاي أنت المؤتي وأنا السائل وهل يرحم السائل إلا المؤتي. مولاي يا مولاي أنت الحي وأنا الميت وهل يرحم الميت إلا الحي. مولاي يا مولاي أنت الباقي وأنا الفاني وهل يرحم الفاني إلا الباقي. مولاي يا مولاي أنت الدائم وأنا الزائل وهل يرحم الزائل إلا الدائم. مولاي يا مولاي أنت الرازق وأنا المرزوق وهل يرحم المرزوق إلا الرازق مولاي يا مولاي أنت الجواد وأنا البخيل وهل يرحم البخيل إلا الجواد مولاي يا مولاي أنت المعافي وأنا المبتلى وهل يرحم المبتلى إلا المعافي مولاي يا مولاي أنت الكبير وأنا الصغير وهل يرحم الصغير إلا الكبير مولاي يا مولاي أنت الهادي وأنا الضال وهل يرحم الضال إلا الهادي مولاي يا مولاي أنت الرحمن وأنا المرحوم وهل يرحم المرحوم إلا الرحمن مولاي يا مولاي أنت السلطان وأنا الممتحن وهل يرحم الممتحن إلا السلطان مولاي يا مولاي أنت الدليل وأنا المتحير وهل يرحم المتحير إلا الدليل مولاي يا مولاي أنت الغفور وأنا المذنب وهل يرحم المذنب إلا الغفور مولاي يا مولاي أنت الغالب وأنا المغلوب وهل يرحم المغلوب إلا الغالب مولاي يا مولاي أنت الرب وأنا المربوب وهل يرحم المربوب إلا الرب مولاي يا مولاي أنت المتكبر وأنا الخاشع وهل يرحم الخاشع إلا المتكبر مولاي يا مولاي ارحمني برحمتك وارض عني بجودك وكرمك وفضلك يا ذا الجود والإحسان والتول والامتنان برحمتك يا أرحم الراحمين اللهم صل على محمد وآل محمد وعجل فرجهم. Now I would like to request Dr. Arshad Quyyumi, Dr. Muhammad Ali Arbab and Dr. Nasir Asghar to inshallah talk about hypertension. Bar Muhammad wa Ali Muhammad salawat. Allahumma salli ala Muhammad wa ali Muhammad.
You sure? Assalamu alaikum. Dr. Quyyumi, you want to start? You want to start? Assalamu alaikum, everyone. Thank you so much for letting the three of us talk a little bit about hypertension. We thought this would be a good sort of education session, for the community. And if there's anything, we can do, we'll be available after iftar time as well. And, you guys have our numbers, you can reach out to us with emails as well. I just wanted to point out a little bit over here that, this is just some general guidelines which we would sort of stick by. Everyone is individualistic. If they have any hypertension issues, we're going to talk about hypertension though, but if they do have hypertension, if they're on any medications, then we suggest, you talk to your primary doctors. And, rather than making specific, sort of advice over here, this is more intended towards general, advice. So, Bar Muhammad Wali Muhammad Salawat. So, hypertension, basically it means elevated blood pressure, It's a little bit of a complex topic and I don't want to go into the complexity too much, but what defines hypertension is, a blood pressure of more than 130/80. This is according to the American College of Cardiology, American Heart Association, and the US Preventive Services Task Force 2017 guidelines. So they keep changing these guidelines. Before, It used to be 140 over 80 as stage 1, but now they've actually decreased it to 130 over 80. And stage 2 would be defined more so as 140 over 80 or 130 over 90. So there are two numbers over here which you look at. One is the upper number, which is called the systolic number, and the lower number is a diastolic number. And then for us, as clinicians, both numbers are very important. And if one of the numbers stays elevated, like a lot of people come to us in the clinic and they say, well, the lower number is actually elevated all the time and not the upper number, then what we try to do is, we take an average, or we just look at the lower number. If it's more than 80 or 90 consistently, then that's defined as hypertension. So basically, in the big scheme of things, and to just summarize this, hypertension is elevated blood pressure. When I get some calls from back home, some of my family members and extended members from my wife's family, or someone else who wants some medical advice, and I would talk to them, if you have hypertension, and they say, nahi beta, koi tension nahi hai. So it does not correlate with tension. Hypertension is more, just want to clarify, it's more elevated blood pressure. So how does this happen? There's two kinds of blood pressures. One is primary hypertension, other is secondary hypertension. 90% of the people, walking around, and if I pick up, like, say 10 people off this street, and if I check their blood pressure, and 4 might have elevated blood pressure, I will not right off the back, start to label them as, hypertension. So to diagnose hypertension is a little bit tricky and complex, but it requires multiple visits to the clinician, plus also some home blood pressure monitoring as well, which we definitely, we can talk about that, on an individual basis, how that is done. But again, 130 over 80 is what, we define that. So as I said, most of the blood pressure, the hypertension, we call is that primary hypertension. We just don't know why that happens, with all the advances and everything, but there are some risk factors which we've sort of alluded to and, come up with in scientific, research. One of them is obesity, like the more blood, weight you gain, yes, definitely that leads to blood pressure elevations, we know that. Smoking is one of the other elements as well, that yes, that can lead to elevation in blood pressure as well. Alcohol intake, can do that as well, and, according to what we sort of counsel the Americans, 1 to 2 drinks per day is actually more than enough and no more than that. Hopefully nobody drinks over here, but I'm just saying. And then family history. Family history is very important as well. So we've seen that, if one of the parents have hypertension, the chances of the child having hypertension, not the child, but, I'm talking about, like say if my parents, one of them have hypertension, the risk of having hypertension in me would be at least 30 to 40%. So yes, there's a definitely correlation. And the biggest environmental thing is, lack of exercise and salt intake, sodium consumption. So, we do recommend to prevent hypertension to consume no more than 2.3 grams of sodium per day. Or even with people who are hypertensive, we talk to them about restricting their diet to, around 2 grams or 2.3 grams. Nasir, how much would that be?
2 grams?
Yeah. Teaspoonful, something like that. Yeah.
5 grams.
Yeah, something like that, yeah. So a teaspoonful, something like that would be. According to the most, recent, I was just looking through some of the data, but the American diet is, very rich in sodium consumption. And we as Americans, we're eating around 5.5 grams of sodium per day, compared to what we are actually telling a hypertensive patients to restrict it to 2 grams. So that's a big number, which we're consuming more. And reducing just that will decrease your upper number by 8 to 10 millimeters of mercury, and the lower number by 5 millimeters of mercury. So that's a huge difference. We do see blood pressure is more common or resistant or hard to treat in the black population compared to the white population, and that's just a general thing, So race definitely plays a role, and Dr. Quyyumi, has done a lot of cardiometabolic risk profile. He can tell you definitely better about the Asian descent, from Southeast Asia, where we come from, and we definitely, we're at, along those lines as well. So what happens, if you have high blood pressure for so long? What does it do? Why are we even talking about this? There's definitely consequences of hypertension, right? And the biggest consequence is, cardiovascular events and cardiovascular death and cardiovascular risk increases. So what that means with cardiovascular risk, cardiovascular death, cardiovascular events, what that means is, your chances of having a heart attack is twofold. Hemorrhage in the brain, kidney failure, problems with arteries in the legs, in the brain, and so on and so forth, And eyes, the heart can enlarge. So a lot of things can happen on the organ side, where, you can lose your eyesight, you can have a bad stroke, you can have a bad heart attack, which can actually take your life. You can actually, have a bad cerebral hemorrhage, and so on and so forth. So untreated hypertension has consequences, long term and short term as well. Some people come to the clinic and the first blood pressure which we check, the nurse would just come and tell me, this is a young guy, only 25 years old, and his blood pressure is 200 over 180. That is hypertension, regardless of checking it 10 times, 20 times. That is too high for me to just say, well, go home and come back in 6 months, or 3 months. We do screen people for hypertension, and again, according to what we talked about, the ACC, AHA guidelines, American College of Cardiology and AHA, they do talk about screening everyone who is an adult, 18 plus, at least yearly, or if you have risk factors like diabetes, congestive heart failure, family history, smoking, other things, you should be screened for hypertension every 6 months, which again, which we don't ever do that. So by the time the patient comes in, he's 40 years old, and then, we are checking his blood pressure, the kidney function, it's already too late because the kidneys are gone, the eyes already have damage, the heart is enlarged, people have developed congestive heart failure, and so on and so forth. So these are some of the things. And the environmental factors, which definitely play a role. We talked about, obesity, we talked about, smoking, but over-the-counter non-steroidal anti-inflammatory drugs, which are ibuprofen, Aleve, Advil, Motrin, naproxen, these drugs are easily available and they can increase your blood pressure and also cause other electrolyte problems as well. So be careful when using these drugs, especially if you are diagnosed with hypertension. Some women are on birth control pills as well, and they can elevate blood pressure and cause other problems as well. So again, this is sort of a general, education on hypertension, but every individual patient is sort of, tailored to their needs, because we don't know your history all that well, but we are happy to, answer any questions, You want to add something, Dr. Quyyumi?
That's good. Questions, please.
– 130 over 80 is what we define as high elevated blood pressure. Above.
No, there is no, there used to be, at one time we used to say that as you get older you can afford to have higher blood pressure, but now the guideline is the same for everybody. So if you want to know, normal blood pressure is 120 over 80, below 120 over 80. Anything above that is elevated blood pressure. And then there is this high blood pressure, very high blood pressure, and so on. But that's your goal, is to keep it around 120 over 80 or lower, whatever age. So there is no bad low blood pressure. For example, young women will have a blood pressure of 90 over 60 and be perfectly functional, especially during pregnancy and so on. It could be 85. So low blood pressure is when you start feeling dizzy or having side effects of having low blood pressure. So you stand up, you get lightheaded, that would be a sign of low blood pressure. But just a number itself is not very helpful. The lower it is, the better it is, as long as you're not feeling bad. When you're sleeping, it's very low. Blood pressure goes up and down during the day, so it's not going to be the same every time you measure it. It'll be all over the place, and people get worried about blood pressures being all over the place. But it's meant to be, depending on what else is going on. So at nighttime, it'll be a lot lower, almost 15 millimeter lower than it'll be during the daytime.
So medication for, number one is exercise. If you're sedentary, that's your highest risk for high blood pressure. So activity, decreasing salt intake, two biggest ones. If you smoke, decreasing smoking, alcohol if you drink, but that's probably not an issue here. And in terms of medications, there are different medications for blood pressure, and it depends on your state. If you're diabetic, the medication is a little different than if you are have kidney failure. It's different. So the medication really has to be done by your primary doctor, because it's not one medication for everybody. It's depending on the side effects. But I think primary lifestyle modification is number one. Exercise, decrease salt, decrease caffeine, decrease smoking. exercise. Get up, walk around. Oh, immediately had a lowered blood pressure. Oh, I mean, immediately you could take some deep breaths, relax, go to a dark room. I mean, if your blood pressure is that high, but you could probably check it. I would check it, see what's going on. If it's high, if you have some blood pressure medication to take, if it's like 180, 190, you need to treat it. Because I don't think you can physically take anything that's going to
It would be best, if it's high, and if you're on medications, then you definitely should contact your doctor right away. That would be the best thing to do.
So one of the things to remember is that when you're feeling bad, for example, if you got hurt, or you have some excitement going on, some bad news, that's not the time to take your blood pressure. What we're talking about is blood pressure being taken when you're at rest. You're sitting down, your arm is out like this, rested, and that's when you take your blood pressure, roughly about the level of your heart. But when you've just gone out and mowed your lawn for half an hour and dug a few holes for trees, you can't come in when you've started to feel a little lightheaded. You can't take your blood pressure. If it's very high or very low, it has no meaning. Blood pressure is supposed to go up every time you get excited or anything like that happens, you exercise, etc. So a lot of the time people get distracted by these strange blood pressure readings. But what really we want to focus on is what is it when you're rested. And perhaps take it in the morning and in the evening, different times of the day, so you get a good picture of what your blood pressure is doing throughout the 24-hour period. And keep doing it for a while to realize whether or not you have high blood pressure.
Yeah, that's an excellent point, and sort of elaborating on that point, there's a thing called white coat syndrome. The white coat comes from the doctor wearing a white coat, right? That's why I don't wear one, and honestly I don't. So do you?
No.
Dr. Quyyumi does, but because I've seen him many times in the hospital, right? Okay, all right. So anyway, so I don't wear one. So people who have elevated blood pressure in the doctor's office, and I'm one of them actually, because I get very anxious. Doctors are the worst patients. Anyway, so that is called white coat hypertension. That is at risk. Those patients are at risk of developing hypertension in the future. So what we do is, we tell them to go home, check their blood pressures at home when they're well rested, the way Dr. Quyyumi alluded to. And when you're checking your blood pressure, it has to be at the heart level. You should have been rested for at least 5 minutes. But if you look at the guidelines, they talk about 30 minutes and all of that, which is very, very difficult. You shouldn't have consumed caffeine in the recent past, maybe in the last hour or two. You haven't smoked, your legs should be touching the ground. They shouldn't be crossed like, just relaxed. So people who are sitting, back home, I remember, the doctor would just put you on the examining table and the kid's leg is not touching the floor. That's actually not the right way to actually check blood pressure. So touching the floor, not crossed, relaxed, not had caffeine, not had, all of that smoking and everything, and then check it. But ambulatory blood pressure monitoring is another issue, but checking blood pressures at home definitely and comparing it with in the office readings is actually very helpful to see whether you have hypertension or not.
I think about 1 to 2 minutes. Your blood pressure is going to vary quite a bit. If you get an odd blood pressure, wait 2 minutes to recheck it. I think Dr. Arshad made a great point about how don't check it right after you exercise or you're in pain. I think that's a good point.
In the hospital, we get a lot of calls about high blood pressure because of pain. We try not to treat that. We let it alone. Resting is better, but excess, like if it's elevated, I would rest. But walking will definitely not, cause any problems as well, So not a rigorous exercise, but, if you definitely want to go out for a walk, it's absolutely okay. Unless, it's touching 200 over 120 or something. What else?
The association of heart rate with blood pressure numbers, like some people use wearable devices to measure heart rate and then make any assumptions or conclusions about it.
No, there is no clear association between the two. So you can't measure your heart rate and guess what your blood pressure is. It needs to measure blood pressure. So. Other questions?
Any questions from the ladies? You guys are very quiet. excellent question.
Right. So, you know, as I say, it fluctuates. So you want an average of what's going on. Some people get excited about taking blood pressure. So like was said, you know, you wait 5 minutes, you take it again. And then if the two are very different from each other, you take it the third time and then take the average of the last two and decide that that's what your blood pressure is. But, you know, it's really, you need multiple readings. That's what we are trying to get through, is the blood pressure is not something you make a diagnosis of based on one reading, right? That's why we're arguing that you need to take multiple readings over multiple days, and then you take your whole booklet, you know, where you've written them down, or now there are lots of apps you can use, and you can take that to your physician and they can decide whether or not you have high blood pressure. So those of you who just came in, we're talking about high blood pressure. And you can ask questions regarding that subject.
Don't check your blood pressure and don't know. Why are you checking it? If you don't check it, you don't know if you have it. So
we mentioned this before, but just to reiterate, when you're getting a headache, don't measure your blood pressure. Because when you have any pain, whether it's in your head or leg or anywhere else, it's likely to be high because of the pain. So taking blood pressure at a time when you are under stress of any kind is not a real reading. And then trying to take medicine or extra medicine for that is also not the right thing to do. If you've got a headache, take a Tylenol and then your blood pressure will come down because the headache goes away. So you don't treat your blood pressure, high blood pressure during stress with blood pressure medicines. You get rid of the stress first.
And historically, it's been called a silent killer. So usually when people come to my clinic and they say, well, I know when my blood pressure is elevated. No, that's actually usually not true, because the way Dr. Quyyumi alluded to, what came first, the chicken or the egg, right? So the headache is causing the blood pressure, or the blood pressure is causing the headache? It's absolutely not. So relax, drink some water, take Tylenol, and see if the blood pressure can come down. Or the headache can get better, you know. So, yeah.
So the message is that blood pressure doesn't hurt. You can't feel it, you can't guess it. You have to measure it. So people say, well, it must be okay because I feel fine. Feeling fine has got nothing to do with blood pressure. The two are, there's no correlation between how well you feel and what your blood pressure is. It could be sky high and you'll feel really good, or vice versa. So remember, the only way to know what your blood pressure is to measure it. Everybody should, like your child's birthday, you should know what your blood pressure is. Who knows their blood pressure? There's one person, too. So you really should know what your blood pressure is because you've had it measured at least once a year, hopefully more frequently than that. If you don't have a machine at home, go to Kroger or wherever, and then, there's always a machine there. At least it used to be before COVID. And you can measure it there. But then don't walk into Kroger from outside and have it measured. Measure it after 15 minutes of sitting there and doing nothing. So that's important, because often those blood pressure readings are high, and that's because you rushed in and did it and ran away again. So have to take the same care and attention when you. So blood pressure doesn't hurt. You should know what your numbers are. You should know whether it's high or low. Take care of these lifestyle things such as salt intake. If you're eating canned foods and things, these are very salty. Our food is very salty. So you have to pay attention of how much salt is going into foods. Don't add it unless you have to, like in roti or chawal and all of that. Minimize it. Like we're saying, the recommendation is 2.3 grams a day, which is actually very little salt. And most of us are consuming much more than that.
Just like a teaspoon. So.
Exercise is important. Exercise is said to be 2.5 hours of exercise a week, which is half an hour of exercise per day for 5 days a week, which is not a lot, but most of us don't do that either. Not gaining weight is important. Weight gain also is associated with this, as is diabetes and all the other things we said. Women can get it during pregnancy, so this is so-called gestational hypertension. It's a condition by itself, but it often goes away when you deliver. But then those women are at much higher risk of developing high blood pressure later on in life. So it's something that you don't ignore. Watch that. If you've had high blood pressure during pregnancy, you're likely to develop high blood pressure during your older years. Extremely common conditions, 75% of people over the age of 60 have high blood pressure. So more of people like me and above will have blood pressure than not. Even between 20 and 40 years of age, 35%, 1 in 3 people is likely to have high blood pressure. So it's a very common condition. It's mostly driven by lifestyle, all these things that we keep mentioning. They're all the same.
They're all the same, yeah. So the pink salt has more minerals in it, with magnesium, everything, but that does not, the patients ask me this question all the time, that does not really mean anything, You still have to stick with the 2.3 grams of sodium every day. And again, what Dr. Quyyumi talked about, the pregnant females as well, but there are certain places where the blood pressure can be very high, especially if you're on multiple medications, so that could mean secondary hypertension, which I did not touch base on, and we don't want to get you guys too confused. But that is something you really want to talk to your doctors about, which, if it goes unnoticed, it can cause really, havoc. Anything else?
What is the level of low blood pressure where one should increase?
Yeah. So low blood pressure is when you start to feel symptoms of low blood pressure, which are dizziness, lightheadedness, especially if you stand up, you feel kind of, unsteady. That would be a sign of low blood pressure, too low of blood pressure. But otherwise, there is no such thing as low blood pressure. Low blood pressure is too low only when you start feeling side effects from it. For example, young children and young women have blood pressure in the 90 range, 90 systolic, 60 diastolic. When they're sleeping, it's probably 80 systolic. So there is no such thing as low blood pressure. It also depends who you are and how old you are and all that kind of stuff. So it's really symptoms while you're taking medicines that are associated with some lightheadedness, etc., would be what you'd construe as too low blood pressure for you.
So especially some of the medicines what Dr. Quyyumi is talking about can really make you lightheaded. And that's when, you might be concerned about something, which is very common in men, once they hit age 60 or above, is prostate enlargement, So some of the medications that you use for prostate enlargement, they can really make you very lightheaded. But if you look at the blood pressure can be normal. So just, it has to be taken in the right context. You see what I'm saying, right? And being lightheaded, you could also have a lot of other medical issues as well, although your blood pressure could be normal, So then, medications and something else if it's going on, or if you have what we call as postural hypotension, which can happen in the elderly as well. But the way Dr. Quyyumi said, age is a risk factor for hypertension. Absolutely it is. But does not mean that we don't see hypertension in a 20-year-old kid, where we have to investigate for other causes of hypertension and just not start them on medications. Yeah, and if people have any personal questions, or, about their medications, everything, Dr. Quyyumi, Dr. Asghar, and I will be outside, after iftar, or, you guys can have our numbers, feel free to reach out to us. We're more than happy to help. Dr. Anis Quyyumi sitting over there as well. Very good point.
Yeah. So measure it in the upper arm and not on the wrist. You can get all these machines that have wrist cuffs, so they're not as accurate as the one up here. And then the cuff size should be proportionate to the size of your arm. The bigger the arm, the bigger the cuff size. So if you have a really big arm, then you need to be sure that you're buying a machine with a bigger cuff size. And then, if you have to gift something to somebody, just give them a sphygmomanometer, a blood pressure machine. They cost around $50.
Thank you, Dr. Nasir. Thank you. Thank you. Jazakallah.
محمد وآل محمد صلوات الله صل على محمد وآل محمد وعجل فرجهم. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا عليه وسلموا تسليما. الله أكبر. الله أكبر جل جلاله. الله أكبر. الله أكبر. أشهد أن لا إله إلا الله. أشهد أن لا إله إلا الله. أشهد أن محمدا رسول الله. صل على. أشهد أن محمدا رسول الله. اللهم صل على. أشهد أن أمير المؤمنين وإمام المتقين علي ولي الله.